Good morning. I'm Jonathan Fielding, Director of Public Health and Health Officer for LA County. I'm joined by Dr. Helene Calvé and Dr. Takashi Wada, the respective health officers for Long Beach and Pasadena. And thank you for being here, and thank you and the media for your continued help in informing people about the continuing pandemic and about reinforcing the value of getting immunized if you were in the high-risk group. H1N1 pandemic flu remains a serious health threat. While it appears that the peak of this wave has passed, there are a lot of people still getting sick. There were over 100 hospitalizations for flu-like illness last week. There will be a lot of people who are in fact getting sick with H1N1 over the coming weeks, and there is the significant possibility of a third wave of this. Possible to predict, but certainly very much within the realm of possibility for later in what would be a traditional flu season. We have already had 88 deaths from H1N1 pandemic strain influenza in Los Angeles County, and nationwide 90% of the mortality has been in those under age 65. What we wanted to do was to today call your attention to an important shift in our general distribution strategy. For the past 5 weeks, our public health departments have helped provide vaccine to LA County residents in the high-risk group through mass vaccination clinics done in partnership with local city governments. And I'm very proud of the nurses, the doctors, and the other staff that have been responsible for setting these up all around the county and providing more than 175,000 doses of vaccine to high-risk individuals. And as the initial vaccination push, when we had an unexpected shortage coupled with increased demand, the availability of these mass vaccination clinics was extremely important, and I think has been a tremendous success. But with increasing shipments of the vaccine, it's becoming more widely available through private providers, and we are therefore going to be asking those in the high-risk groups who have health insurance to seek care, to seek immunizations through their usual source of care. While supplies are still limited, the vast majority of the 3,000 plus private providers that signed up to receive vaccine have received at least a portion of their order. At this point, over 3/4 of all the vaccine allocated to Los Angeles County has gone or been allocated to private providers, and from this point forward, it will be about 95%. So it's really going to be concentrated in the private sector. The last sponsored mass clinics for vaccination will occur between December 4th and December 8th. Public health departments will still be providing vaccine to those without other sources of health care through our community partner clinics. In addition, a limited number of appointments will be available at one of our Los Angeles County public health centers. For more information on where to find a health center or a community clinic, check our website, please, at www.publichealth.lacounty.gov or call the LA County information at 211. And we are linked to Pasadena and Long Beach, so if you live in those jurisdictions, you can find out the best information directly from those linkages. In addition, many of the schools in the LAUSD school district and other school districts throughout the county will be holding their own smaller vaccination clinics for students. Some of these schools have already been able to vaccinate hundreds of students. Further, at least 28 colleges and universities have held or will be holding H1N1 vaccine clinics within this county for their students. I want to thank our community partners in the cities who've helped organize these mass vaccination clinics, as well as the nurses, the paramedics, the firefighters, the law enforcement officers, all of which, and the volunteers who've helped make this a success. It's important to remember that the clinics that we set up were originally just set up for those who didn't have other sources of health care, but they have served to increase access to anyone in the high-risk group that couldn't otherwise find the vaccine. And the public has by and large been very patient in dealing with long lines and the need for rigorous screening to make sure that those in the priority group are those who came forward first to receive the vaccine. I want to thank everybody who had to stand in line. Thank you for your patience and for your support of public health. A special thanks to our community partners in the cities who helped organize the clinics, as well as, again, everybody who helped to staff them. As before, we still recommend the CDC-identified priority groups receive the vaccine first. They are pregnant women, those who take care of children under 6 months of age, children and young adults 6 months to 24 years, adults 25 to 64 who are at high risk for complications due to health problems such as diabetes or asthma or heart condition or emphysema, and healthcare and emergency medical service personnel.